Hello everyone, welcome back to my YouTube channel. Today our topic is fat soluble vitamins. Let us see this topic in a very short, in a tabular format manner. Let's get started. So the first vitamin that we have is vitamin A. So remember, fat soluble vitamin, the vitamins are ADEK, A, D, E, K. So remember this. Okay, so starting off with vitamin A. The active form of vitamin A is retinol, retinal and retinoic acid. So let's write it down. Retinol, retinol and retinoic acid. So vitamin A has three active forms: retinal, retinol and retinoic acid, alcohol form, aldehyde form and acid form. So in male, how much RDA is required? In male it is 600 micrograms. In female again we need 600 micrograms, and during pregnancy 800 micrograms. So during pregnancy more vitamin A is required, and during lactation even more vitamin A is required. So it is 950 micrograms. Okay, generally we require 600, but during pregnancy extra 200, that is 800, and during lactation a little bit more extra, that is 950. What are the sources of vitamin A? So vitamin A, the sources are fish liver oil, cod liver oil. So remember two oils, fish liver and cod liver. Then meat, spinach, etc. Right? Then what are the functions of vitamin A? We have vision is the main function of vitamin A. Vision. So in vision, where they are helpful? In Wall's visual cycle, rhodopsin. Okay, Wall's visual cycle. And they are also required for cell growth and differentiation, and they are required for cholesterol synthesis. Okay, so for vision, cell growth and differentiation, cholesterol synthesis. So now deficiency. Since its function is vision, then deficiency will automatically lead to blindness. So especially night blindness in case of vitamin A. Night blindness. And then we have conjunctival and corneal cirrhosis. Conjunctival, corneal cirrhosis. Then we have Bitot spots. So these Bitot spots are like white color spots in the eyes. Okay. And phrenoderma, which means rough skin, and hyperkeratinization. You can also call it as toad skin. Rough, dry skin, like toad skin. Hyperkeratinization. So this is about vitamin A. Next vitamin we have vitamin D. So vitamin D, the active form of vitamin D is calcitriol. So calcitriol is nothing but 1,25 dihydroxy cholecalciferol. So calcitriol is the active form of vitamin D, which is nothing but 1,25 dihydroxy cholecalciferol. In children, 400 international units are required. That is more vitamin D. Whereas in adult, only half of it is required. That is 200 only is required. So remember this. Obviously, vitamin D everyone knows. The source is sunlight. And we also get vitamin D from seafood and egg yolk. Next, what is the function of vitamin D? Vitamin D is related to bone. So remember, in bone, it causes mineralization. Mineralization. That is deposition of calcium in the bones. Increased absorption in the intestine. It leads to increased absorption of calcium. In renal tubule, reabsorption of calcium. So basically it absorbs calcium, okay? It absorbs calcium and deposits in the bone, mineralization. In intestines, it increases the absorption of calcium. In renal tubule, it increases reabsorption of calcium. So remember, vitamin D and calcium are friends, okay? So that you can correlate with the functions of vitamin D. Next, so obviously, since the function is related to bone, then the deficiency will cause some bone disorder. So we'll have rickets and osteomalacia. In children, it is called as rickets. So some features of rickets include bow legs. So the legs become something like this, okay? They are not straight like this, they become bow shaped. So bowing of legs. Frontal bossing. The forehead becomes widened, that is frontal bossing. Widening of wrist. These are all the features of rickets. Whereas in adult, it is osteomalacia. Osteomalacia. Osteomalacia means easy fracture. Easy fracture. Decreased bone mineral density. Since it helps in bone mineralization, the deficiency will cause decreased bone mineralization. Okay. So this is about vitamin D. Next we have vitamin E. The active form of vitamin E is tocopherol. Tocopherol. In males, 10 milligrams are required. In females, vitamin E, only 8 milligram is required. So vitamin E we get from vegetable oils like wheat gram oil, cottonseed oil, safflower oil, sunflower oil, etc. Okay, you get from vegetable oils. And the functions of vitamin E include, the main function of vitamin E is antioxidant. Okay, antioxidant, hence it also prevents lipid peroxidation. Okay, and it also maintains the integrity of RBCs. Okay, it protects the RBCs from hemolysis. They protect RBC from hemolysis. Okay, vitamin E are good antioxidants. They prevent lipid peroxidation and protect RBC from hemolysis. Since the function is protecting the RBC from hemolysis, then the deficiency will cause something related to hemoglobin or RBC, that is anemia. Okay, correlate the deficiency with the function. It will be easy to remember, right? Okay. So next we have A, D, E, and finally we have vitamin K. So for vitamin K we have K1, K2 and K3. Each of them have their own active forms. For K1 it is phylloquinone, K2 menaquinone, K3 menadione. Okay, so how much is required? About 70 to 140 microgram is required. So the sources for K1 is green leafy vegetables and spinach. Green leafy vegetables and spinach. And for K2 by intestinal bacteria. So K2 will be produced by intestinal bacteria, and K3 is synthetic and water soluble. And this is water soluble, so not fat soluble. Here we are studying only about fat soluble, but K3, remember, it is water soluble and it is synthetic. So the functions of K3 is clotting. So how they are helpful in clotting means the post-translational modification of clotting factors. So they are required for post-translational modifications of clotting factors 2, 7, 9 and 10. They are required for post-translational modification of clotting factors 2, 7, 9 and 10. Okay, so obviously if the function is clotting, then the deficiency will cause bleeding disorders. Clotting is improper, then what will it cause? It will cause bleeding disorders and increased clotting time. Okay, so this is a short table about fat soluble vitamins. So let us see, just revise it once. Vitamin A, D, E, K, these are our fat soluble vitamins. Now vitamin A, the active forms are retinol and retinoic acid. In male and female we will require 600 micrograms, but in pregnancy and lactation we require a little higher. The sources of vitamin A are fish liver oil, cod liver oil, meat and spinach. So the function is mainly vision, then the deficiency causes night blindness, and it is also required for cell growth and cholesterol synthesis. Apart from night blindness, it can also cause phynoderma, that is rough skin or taut skin. Then we have vitamin D. The active form is calcitriol, 1,25 dihydroxycholecalcitriol. So children 400 and adult 200. The sources are sunlight, seafood, egg yolk. It helps in bone mineralization and increases absorption of calcium in intestine and reabsorption of calcium in renal tubule. In children, it helps. The deficiency causes rickets. In adult, it is osteomalacia. And vitamin E active form is tocopherol. In male 10, female 8. So the sources are vegetable oils, wheat gram oil, cottonseed oil, safflower oil, sunflower oil, all types of vegetable oils you can include in vitamin E, and it acts as antioxidants and prevents lipid peroxidation and protects the RBCs from hemolysis. So since it protects RBC as its function, then the deficiency will cause something related to RBC, that is anemia. Next is vitamin K. We have K1, K2, K3, out of which K3 is synthetic and it is water soluble. K1 is from green leafy vegetables and spinach, and K2 is from intestinal bacteria. The active forms of K1 are phylloquinone, K2 menaquinone, K3 menadione, and the RDA sources required are 70 to 140 micrograms. The main function of vitamin K is clotting, and it is required for the post-translational modification of clotting factors 2, 7, 9 and 10. Now, since the function is clotting, then the deficiency will cause improper clotting. So clotting time will increase and the bleeding, excessive bleeding will be there, okay, without clotting. So it causes bleeding disorder and increased clotting time. So yeah, if you like this video, please like, share and subscribe. Thank you.